Good afternoon. Welcome to the season premiere of the show. I'm your host, Melissa Ridgen. Well, the last time we were here, it was the end of May. We were knee-deep in the COVID-19 pandemic. Fast forward 4+ months, and here we are still in the pandemic. Today, we are putting COVID-19 in focus. We are going to bring you up to speed on what you might have missed, some of the good news, believe it or not, that's come out of the pandemic. We'll be talking with the Canadian Council for Aboriginal Business about some of the success stories. But of course, there's business struggles as well. Some Indigenous businesses have been decimated in all of this. We're also checking in with our cousins from the Navajo Nation. You'll recall last spring it was hardest hit, one of the hardest hit COVID hotspots in all of the United States. At one point, tracing showed that some of the spread that had occurred at ceremonies and other gatherings, there was it had a higher per capita infection rate than even New York and New Jersey. Crazy. So how are they now? We're going to chat with the people there. There's also been some people who have volunteered for a COVID vaccine trial that is at the Navajo Nation, while others say that there is absolutely no way that they are going to be guinea pigs for settler science again. But first, what happens when cold and flu season collides with a pandemic? Well, we have a doctor on to explain that. Also, mental health. How has 8 months of this COVID pandemic affected our well-being? And how do we stay mentally healthy as it continues and drags into the winter that can already be a challenging time for many of us? We want you to join the conversation. We love hearing your thoughts about our topics, but because of COVID, we don't have any guests in studio to answer the calls that you would make, so we aren't taking phone calls. However, APTN News Facebook page is live streaming this right now. You can join the conversation there. Before we meet our first guest, here's producer Beverly Andrews with a look back at what got us here.
In December 2019, reports of a strange illness infecting people in Wuhan, China emerged. Doctors did not know much about this new virus, other than it was contagious and becoming increasingly deadly. Then the illness was reported in other areas of China, then other countries, then other continents. Flights across the globe cancelled. Countries called their citizens home, lockdowns mandated. By March 2020, COVID took hold of Canada. People sent home to limit exposure. Life changed in an instant. The streets, empty. Business shuttered, coming to a standstill. Students sent home, and school doors closed. The future, unknown. Things have gotten a bit back to normal. That now includes social distancing, even in small groups. Wearing masks in public and keeping your hands clean is more important than ever. The world infection rate today is 36.1 million, with over 1 million deaths. Canada has over 171,000 infections, over 9,500 deaths. First Nations communities have reported 772 confirmed cases and 13 deaths. The territories have reported 20 confirmed cases, 0 deaths. Nunavut is still the only region in Canada to report 0 cases.
Thanks for that, Beverly. With those numbers in mind, a new First Nations health entity called Kiiwetinoong Minuyawin has come out with a 90-second public service announcement that encourages everybody to get their flu shot this season. Here's a look at the video called Breathe.
From our first breath, we feel the heartbeat of the land, the rush of the water, the warmth of the sun, connecting us, reminding us to be grateful, to take care of the land, our health, and each other, to build wellness, so we can continue to sing and tell stories to our children. We feel the heartbeat of our culture protecting us, encouraging us to thrive and to stay strong so we can live a good life and breathe.
In preparation for the flu season and to protect our elders and families, Inuit encourages you to make your appointment to get the flu vaccine.
Joining us now is Dr. Barry LaValle. He's the Chief Executive Officer of that newly formed Health and Wellness Division within Manitoba, Kiiwetinoong, Okanagan, which is the advocacy group that represents all First Nations in northern Manitoba who are signatory to Treaties 4, 5, 6, and 10. You will recognize him from that PSA that we just saw. He took some time out of his incredibly busy schedule to chat with me earlier this week. So, Dr. LaValle, we just saw the public service announcement done by Manitoba, Kiiwetinoong, Okanagan. Lots of questions about cold and flu season approaching. We're still in the pandemic. Will all of the precautions that we should be taking, that the social distancing, the extra hand washing, masks, is that expected to dull the cold and flu season?
The information we have from our public health experts internationally say that, in fact, influenza rates are lower because of the precautions adopted for the COVID pandemic.
And do you expect that there's going to be, an increase of panic or hysteria, I guess? Every time you hear somebody with the sniffles or coughing or sneezing, there's going to be a different reaction maybe this cold and flu season than there would be historically. What are your suggestions to us as we navigate these weird times?
Well, the big challenges for a lot of our communities in the north is fear. A lot of people feel fear right now, and a fear reaction is appropriate given the status of this COVID-19 in our communities currently where I'm at. But one of the things that we're doing at our organization, Inuit, is we're doing PSAs and different messaging to community people to take the flu shot, but also to pay attention to opportunities to quit smoking, pay attention to cooking at home, to walking, to sleeping as well as you can, all in the really to strengthen our immune systems should we be confronted with a virus during this pandemic.
So, I mean, if we were thinking about, social distancing's already happened, extra hand washing's already happening, why should we get flu vaccines?
Well, that's a very good question. In theory, the rates of flu transmission probably will go down, but there's no reason for us not to get the flu shot as an extra precaution. And so we're promoting the influenza vaccine for all of our communities and starting fairly much right away over here in Manitoba.
I wanted to ask you about, COVID testing on First Nations, especially those that aren't close to cities and towns. Have you heard, is there problems with people getting tested? Are there not enough tests? What's on the ground out there?
Well, things are moving in real time, mostly, Melissa. It's difficult to say, but Manitoba First Nations leadership here developed what's called rapid response teams, which are public health and medical experts who can be deployed to a community should an epidemic occur. And currently in Manitoba, the rapid response teams have been deployed. They add to the public health care and the care in nursing stations, as well as supporting chief and councils and health directors and our citizens in general. And they use point of care testing with a machine called a Gene Expert. And it could produce a result in about 1 hour. There certainly are protocols on who could use the test or who has to continue to use laboratory services in Winnipeg.
So in your organization, which obviously covers northern Manitoba, you guys have devised these rapid response units. You've needed to use them. Very recently, there was a COVID cluster that impacted a family at York Landing. We just heard today that there's now 19 cases in Little Grand Rapids. Where did you hear about these, or how, I guess, did the plan for these rapid response units come up? And then is there any advice that you could give people in other jurisdictions how they could get something like these rapid response units working in their communities?
Very good question. The rapid response team concept arose during the conceptual phase of the pandemic, where First Nations leadership, health experts, public health experts, got together to plan out what would happen should an epidemic occur in one of our communities, especially our isolated communities, and communities that might not have a lot of resources to contend with numerous positive cases. And so that conceptual phase was developed by First Nations and health allies in about March or April, and it's taken us this long. Currently, the federal government, our partners, as well as Shared Health and the provincial government are all on board. So it's probably one of the first times, I would add, of a success that there's adaptations in the delivery of services aimed particularly at the context for First Nations people in Manitoba. I would really encourage other jurisdictions across Canada, including the territories, to reach out to us for information on how to develop the rapid response teams. There's been some incredible successes with leadership, First Nations leadership. Melanie McKinnon is the head of Ungamazin Health at the Rady Faculty of Health Sciences, University of Manitoba. She and her team are the operational leads, and so you could reach out to she or Dr. Rafiq and Danny via an email to me at
It's always easier if you have a template to go by as opposed to reinventing the wheel yourselves, especially you know, in the uncertainty of a pandemic, which we're all in. I wanted to go back to you know, I think we're in month 7 of this pandemic. What have you felt like have been the successes or failures for First Nations communities everywhere, really? You know, as you look at this, the time that's happened since we first were hit with COVID back in early spring last year.
Really, the success for First Nations community is in their leadership and the commitment of our Grand Chiefs and our health directors, our councillors, and other leaders in our communities have stood up, and they've taken the task to heart to collaborate across what were jurisdictions before. And we're finding as an overall positive effect, if I might say it in that way, during the pandemic, is that we are all sitting at the table and we're harnessing resources that we never could harness before. And it's really the leadership of First Nations people that actually have prompted this. And in fact, what I might say, Melissa, is that you might say First Nations leadership for First Nations, and now we're moving into a phase, First Nations leadership for all. And that's a very important statement for you to consider, that we've always been leaders, but we've maybe never had the chance to demonstrate that, our skills and our history. And as you know, Melissa, pandemics and epidemics have occurred for 500 years in our communities as a consequence of colonization and people bringing in various viruses. This is not unknown to us, even though historically very few might not have seen a pandemic. This is a known thing for our communities across Canada.
I love those words. I mean, guys, I think there's been a lot of chat, even just here at APTN, saying, you know, it seems like our communities seem to be faring better than a lot of non-Indigenous communities in terms of keeping this virus, you know, out or contained. So those words do ring true. I wanted to ask you too, mental health. This is something that's important to talk about. As a longtime family doctor, what advice do you have? There's so much unrest and worry and uncertainty as we go into the downtime of winter, which could be isolating in and of itself, plus this added worry of COVID. You know, how do we take care of our mental health during these unprecedented times?
You know, I mean, the values that our elders and the people who lead us with our knowledges across this country talk about kindness. And they talk about respect, they talk about forgiveness. And really, as individuals, as First Nations, Metis and Inuit individuals, we have to start practicing kindness now. Even if you feel fear or you feel uncertainty, it's practicing kindness. But I also want to share that one of the really important things for our people across Canada is that we have to repatriate who we are, our values, we have to repatriate our beliefs in a creator, and we have to go to those in our community who understand those values to help us take care of our families, and to reach out. I know it's fearful right now, but reach out to people that you think might need help. Even if it's a phone call, or stand 6 feet away from the door and talk with somebody, offer them food. Now, what people sometimes don't understand, Melissa, is that the disparities that First Nations people contended with and prior to the pandemic are still there. And in some cases, they're amplified through the pandemic. So in some cases, the lack of structural capacity that has nothing to do with being First Nations, but rather the imposition of different ways of trying to conduct oneself in our communities are really amplifying the challenges right now for communities to move through the pandemic, especially some of those communities, I would imagine other places in Canada, who currently have epidemics. So the messaging is partnerships, reach out and demand your rights for services. Demand your rights that public health be beside you if an epidemic comes to you. Don't do it alone, reach out. And we have to actually act as a country of First Nations and Metis and Inuit people through this pandemic and support each other.
Well, not COVID related, but related to, accessing healthcare and being an advocate for yourself. I have to ask you as a longtime physician, what are your thoughts on what happened to Joyce Ashkequan in Quebec? Of course, that's the woman who went to hospital seeking medical care, was in medical distress. She started a Facebook Live, basically live streamed her death while in a Quebec hospital. While she was there advocating for herself, she was there accessing the health services she thought she could rely on. What are your thoughts of what happened in that instance?
We were all shocked. Some people in my crew and my friends and my colleagues across our organizations cried when they saw her being tortured to death. Melissa, I've done work for about 20 years to articulate racism aimed at First Nations bodies in the healthcare system. It's been a long journey for our people. If we open the floodgates, and I've spoken to some senior health officials here in Manitoba, you have to be prepared for about 30 years of information coming to you. So I have to tell you that we're moving from the conceptual idea about anti-racist training as learning to prosecution. And in the case of that young woman of 7 children, she was killed. And because she's a human, we can name it murder. So my official response to that is prosecution of the 2 nurses who denied her access to health care.
Well, I guess we wait and see if that's what happens. Certainly lots of eyes are on that in Quebec. Dr. Lavalley, we really thank you for taking time out of your busy. I know you're busy. I've been trying to get this organized, and you're on the move, certainly. We really do appreciate you taking the time to share with our audience, talking about the tough times of this pandemic and how to get through the winter.
Yes, thank you so much. Have a good day.
You too. Time for us to take a break, but when we come back, your favorite social media editor, Jesse Andrushko, is here with your comments on today's topics, including how many of you are staying mentally well in these challenging times. Good tips for all of us to incorporate into our days. And we'll chat with our cousins from the Navajo Nation, how they're coping. Don't forget, they were at one point the COVID hotspot for all of the United States. Stay with us. The Navajo Nation is the largest reservation in the southern United States and has been a hotspot for the COVID-19 virus. About 200,000 people live in the nation, and about 40% of residents have no access to running water, which makes washing hands difficult. The nation was under a 57-hour lockdown this past weekend due to spikes in the infection rates. After the break, we are going to get an update from the Navajo Nation. Stay with us. Let's go to social media now with our social media editor, Jesse Andrushko, to hear what some of you are saying about today's topic.
Thanks, Melissa. We're 8 months into the COVID-19 pandemic with no clear end in sight. We asked online, what mental health tips can you share with those who are struggling as we approach the winter downtime and the feelings of isolation that often come with it? On Facebook, Matthew said, routine and habit is important, so eating 3 meals, drinking lots of water, sleeping 7 to 8 hours a day. Ashley Bree said, as soon as you wake up, journal 10 things you're grateful for. Set the tone for the day. From Paula, stay positive. You're healthy. Your family is healthy. One day things will be settled with this like every other virus in the world. From Trudy, phone a friend. Every single day, phone one person. Maybe a cousin you haven't spoken to in forever, or high school friend you only see on Facebook. From Danielle, stay off social media. Do as I say, not as I do. Good one. And Amber said, get outside every day. Even just a bit of air on the face will make all the difference. Find a hobby. Bonus if a friend wants to join you. And lastly, from Patricia, acceptance. This might be our new norm for quite some time. If you'd like to add to your opinion to our topic of conversation, here's how. Join our conversation now. Like us on Facebook on APTN News page. Follow or tweet us at APTN InFocus, and send your thoughts to infocus@aptn.ca.
Thanks very much to Jesse and to all of you who took time to share your tips on how to stay mentally well during this seemingly never-ending pandemic. Last May, before InFocus was on hiatus for the summer, we told you about the Navajo Nation surpassing the states of New York and New Jersey for having the highest per capita COVID rate in all of the U.S. Well, since then, the virus has continued in the territory, like it has most places, and it is a huge territory. The Navajo Nation occupies portions of Arizona, Utah, and New Mexico, and is home to 174,000 people. According to the independent Indigenous media outlet Native News Online.net, there are 11 new cases of COVID this week, bringing the total so far to 10,454. This has claimed the lives of 559 Navajo so far. Joining us now from the Navajo Nation is physician Dr. Michael Lerma and medicine man Elder Avery Denny. Welcome, Dr. Lerma and Elder Denny. It's great to have you joining us again. You shared with us last spring the challenges that are faced by the Navajo Nation during this pandemic. You were one of the hardest hit jurisdictions in the United States last spring. How were things over this summer, and how is the nation doing now in terms of infection rates and survival? I'll put that to you first, Dr. Lerma.
It's my understanding that our lockdowns over the weekend, we went on 57-hour lockdowns on the Navajo Nation where non-essential workers were not permitted to travel under penalty of jail time or a heavy fine. And it's my understanding that that made a big difference, and we went from what appeared to be a crisis into a space where we've gotten the numbers down really well. And you know, with everything that's going on, you know, a lot of the families will end up having to travel to border towns anyway. We are in a food desert. And I just didn't see the same protocols in those border town communities as we would find on the Navajo Nation in grocery stores. We couldn't even get into a grocery store without getting our temperature checked. But I know that we've had a spike recently, and because of that, we had a slightly relaxed curfew where it started to begin on Saturday instead of Friday. But I know that there was something like 40 more cases that popped up recently. So we've reinstituted the curfew starting on Friday evening.
Did you guys at least get a break through this summer, a little bit of a reprieve? I mean, you guys were like the COVID hotspot of the United States at one point last spring. Did you guys get a bit of a break in the summer, or how did things go?
We've had a good break. And we actually went one day without any new cases, And I'm not certain if that happened anywhere else within the United States. And so that was something that made me really happy.
No doubt. Elder Denny, if you can hear me, I'm just wondering what has been, from your position as an elder, looking at the toll that this had on the Navajo Nation, what are your thoughts on how the pandemic has affected people, and what's the role that elders have in getting the people through this?
Yeah, I just want to say, to everybody, the listeners, we're down over here in Navajo, around Sahili, Arizona, and the Navajo Nation and surrounding areas. In a rural area, way back, away from everything else, like off the grid, and then small communities, housing complexes around there. Like I mentioned that last time, when we had this interview, that the Navajos, they were not allowed to do ceremonies because of gathering, and they were sort of like drawn away from that for at least for about 3 weeks. So, and then we had the president of the Navajo Nation did a shutdown, like this week and last week, from Friday night to Sunday morning, about 5 o'clock in the morning. We can't leave our homes and we can't drive on the road, and all the gas stations and all the market stores are all closed. Like if you go to the little community, Chinli or Tsehili, Lukachukwe, all the stores are shut, and you can't even buy any gas or anything like that. You can't put your debit card in there, and you can't get gas. So whatever gas you get on Friday, that's all you're going to use, and only the essential are on the road. And within that time, well, it's been like that for all from March to even this weekend again.
Mm-hmm.
And really people, do you find are cooperative with this lockdown when they're told, like, we got to shut down because the numbers are rising? Do you find that people generally appreciate the risks and go about the lockdown?
Yeah, the lockdown is really, really good because you can't visit. There is a fine that you pay, like $1,000 if you're on the road, and that was very strict rule. And I think most of the people they just stay home. Like myself and my family, we didn't go anywhere. We just stayed home, and did work around the home, and the numbers went down. Yes.
Just like the old days. I mean, that's what, before we were busy and had places to be and things that we had to do, there was that downtime. So I'm curious if that's something that you feel, Elder Denny, that people have realized that this is kind of, hearkening back to the old days before contact, when people had that downtime to spend with family. It's unfortunate it's not with, other community members too, but do you feel that this is a kind of a bonding effect that this pandemic's had when we've got to go and get tough and roll up your sleeves?
I think so, yeah. I really truly believe that for myself and some of the family local over here, they kind of like fall back to the old ways. And we're not villages, community, we're scattered home. And my closest neighbor is like a mile away, and that's how the housing or the reservation home is in Navajo Nation, and small communities, and they're scattered far distance, and we just do our business. Like, it doesn't really affect us, to close, have a shutdown. It's normal out here, and families are together and working around the house, and there's no panic. Even the TV goes off. Too busy, too working.
I want to ask Dr. Lerma that there's been volunteer vaccine trials with Pfizer-BioNTech for the COVID-19. They've started on the Navajo Nation. Can you tell us how your nation got involved, and what's been the response from community members when they've been asked, looking for volunteers to try these vaccines?
It's been mixed. I can't really answer the question about how the Navajo Nation got involved. That's not been made clear to me. It was this, I don't know, announcement or a press release that some community members were going to step up and participate in the trials of the vaccine. And immediately there was some resistance because I'm sure that the same is true across many indigenous nations that have been impacted by settler colonialism, that we often get used as guinea pigs, and that those questions were asked. And I don't think that they've been satisfactorily answered. And even in this day and age, with the accusations that that there still continues to be the sterilization of women that were rounded up by ICE raids. Those are questions that, if it's still happening in the 21st century, what else could go wrong? And then there's another group, that's willing to step up and say, we're gonna do this for more than just ourselves. There's a selflessness to it all, and so it's mixed. That's how I interpret things. So yeah, that's. But I wanted to know if I could jump off of what Avery was talking about, because you made that point that it was a great time to stay home. And me and my wife, we planted a cornfield for the first time in our lives. She's in her 30s, I'm in my 40s, and I'm trying to learn some cornfield songs and teaching it to the kids, and so we had those beautiful moments of everybody going out there, and our son is going to be 3 in December, and we allowed him to be the first one to take a gourd and water the corn for the first time when we first planted it. And so we're able to collect some corn pollen, and we're getting a little bit of corn out of it. And it was just a great learning experience. And so that's the positive of everything.
I love that. Getting back to the basics, hey?
Yeah.
Elder Denny, so I'm curious, this will be my last question, I'll let you gentlemen go, but I am curious, when we had you guys on last spring, ceremonies there were ceremonies that were going on, there had been some connection to the spread of COVID at ceremonies and gatherings. Are those back to normal now, or are they being postponed, or are they being held differently than traditionally?
Yeah, not just traditional ceremony, anything that goes with gathering, a birthday party, family getting together and having like activities, gathering, and a ceremonial correct gathering, and everything was all shut down, closed. And just about 2 weeks ago, the president of the Navajo Nation gave a notice and send out like email or post on the internet to go ahead and start ceremonies with only 5 people in the Hogan in sight. It's just like saying like only 20%
right.
of the people can attend. And be careful, wash, and all of that. So that's what we're trying to do today. It's all right to have ceremonies, but you gotta have only a few people with 6 feet apart and everything like that. So, and then of course, there's always that one individual that criticizes the traditional ways and and they try to put it down by saying that certain things are not welcome, or it's all negative from our tribe, coming from most likely from Christians that could criticize the traditional ceremonies about not being safe and all of that. So we have a lot of that. So that really ruins our nation. Indian people criticizing their own religious ways, their own belief, and that hits hard on a lot of. Sometimes it's negative.
Yeah, it
really hurts us like that. So.
Mm-hmm.
We certainly see that in communities up here as well. You know, those kind of clashes between Christianity and traditional ways. But we also see that a lot of communities have blended these two different beliefs perfectly, and it works out well, and everybody's respectful. So it does go both ways. I want to thank you, gentlemen, so much for taking the time to join us again. It is great to have you on. We haven't seen you in a few months. We always love to hear what's happening down in the Navajo Nation with our brothers and sisters down there. Thank you, gentlemen.
Yeah. Oh, you all right?
Yeah.
How going it?
That was Dr. Michael Lerma and Elder Avery Denny, who joined us from the Navajo Nation. I spoke with them a few days ago and got to share it with you all today. Well, we need to take another break, but when we come back, we're going to get into the economics of this pandemic. It has been a tough several months for several Indigenous businesses, while others have shifted and adjusted and are trotting through these uncertain times. We've got the Canadian Council for Aboriginal Business joining us to get an idea of how COVID has changed the way that we do business and what the future might hold. Stay with us. Welcome back. APTN National News has been bringing you stories over the past several months highlighting the struggles and successes that have happened during the COVID-19 pandemic. The Canadian Council for Aboriginal Business is an advocacy group that advances Indigenous business across Turtle Island. Philip Ducharme is the Director of Innovation and Entrepreneurship, and I spoke with him earlier today. Philip, thanks so much for joining us today. So what's the, from that broad perspective, looking at Indigenous businesses broadly across this country, what has been the effect of COVID, specifically on Indigenous businesses, maybe separately from just business in general, non-Indigenous business?
Sure, and let me start by saying thank you, Melissa, for inviting CCAB to join this conversation. I mean, it is really timely right now. When we look at the Indigenous businesses, I mean, they've been affected very much like the rest of the general public businesses. But one of the things are that we want to ensure that as things are starting to move forward, I know that COVID has shuttered a lot of businesses. We don't have the exact stats right now on Indigenous businesses, but they've been affected. I mean, 91% have said that the COVID has really affected their businesses. But I mean, as we start moving forward, we want to ensure that our businesses are not left behind. I mean, for so many years, we were left behind. We have been making strides recently, and we can't let COVID stop the strides that we have been making within Canada.
Are businesses reaching out to Ccab, looking for a plan, looking for some sort of we got your back? I'm just wondering what type of phone calls you guys are having at this point.
You know what, it was very interesting, Melissa, when it first started happening on March 16th is when we first started working virtually. We were receiving calls from Indigenous businesses. I mean, we have a very close relationship with our businesses. We are a member-based organization. So there was a lot of concern to begin with. People were like, there was all the uncertainty. No one knew what was going to happen. So they did reach out to us. I mean, the government announced a lot of different programs to help businesses. But again, Indigenous businesses were left behind in a lot of that programming because of the business structures and the tax implications that came with Indigenous First Nations owned businesses. So, I mean, if you looked at the wage subsidy, quite often, a lot of our businesses are owned by economic development corporations. The government at first deemed those as government entities, so they didn't qualify. So we were behind on that. So we had the calls from these businesses that were going through. I mean, the government wanted businesses to pivot. So we had a lot of businesses that had a lot of excitement saying, you know what, this is what we're going to be doing. and they have pivoted. There hasn't always been the success with the federal government on the procurement of PPE, but there has been some great successes within corporate Canada.
Yeah.
So I think what we were was a sounding board, and then we also take the issues. I mean, Tabitha Bull, our CEO and president, sits on different task forces, and then she brings forward the issues that we hear from our businesses to help implement the changes to ensure that we can benefit the same as the rest of Canada.
I know that there was, the federal government had made an announcement, there was $300 million earmarked for Indigenous businesses to help them get through COVID. Did that help? Where did that money, where did it go? Was it enough?
Well, it was never enough, and I know that money was earmarked, and I think it went through the National Aboriginal Capital Corporations Association. So it went to their members, and again, it was sort of similar to the CEBA program that the federal government announced. And it was $40,000 loans, $30,000 was repayable, and $10,000 was forgivable if you kept up with the payments. So that has went through. I know that that's not enough. There are still businesses that needed more than that. But I mean, I guess every little bit helps. But again, there were hoops that the companies had to jump through to get that funding. And a lot of businesses right now, I mean, they were small. They never really qualified for the financing that was given by the banks. So they did not want to take on new debt. So I think that was a great start. But I mean, there was other different programs as well. I mean, the Indigenous Tourism Association also got some money for their businesses. My understanding was those were $25,000 grants that did not have to be paid back the same way the other $300,000 that you mentioned earlier.
Yeah. Is there a sector, an industry in particular that you're worried about going forward?
Well, you know what? There are a few of them. I mean, if you look at the resource sector, the oil and gas sector in Alberta, I mean, a lot of Indigenous businesses really grew from a result of that, and they were really the first players. The resource sector really came to the forefront to help Indigenous businesses grow. That's an area that's really being affected. There are some successes that are happening, but there is an area there. And tourism, again, a lot of our businesses really rely on tourism, and that has a trickle-down effect. So if you look at some of the businesses, I know that APTN a while ago ran a story about Indigenous people that had Indigenous products that they wanted to sell. The tourism industry was decimated this year, so they weren't able to sell. So they are looking at retail Canada as well to start including our businesses. They haven't been doing it. There was, however, just yesterday I got a call from one of our Ccab companies, one of our certified Aboriginal businesses, Rocky Mountain Health and Safety. They've actually entered a pilot project with Petro-Canada to include their products, their safety equipments within the convenience stores across BC and Alberta to start off with, in all Petro-Canada convenience stores. And if that pilot project is a success, it'll go across the country. I know even within the Bay, they don't have a lot of Indigenous suppliers, but there is Aurora Heat, who had, in Winnipeg, actually I was down there last year, and I've seen their display at the store in Winnipeg, and I know that she's trying to increase that. But again, I think that's where we have to look at corporate Canada, we have to look at the government, we have to look at all organizations to help us, and they have to pay attention to us. That's how we're going to succeed with this. Yeah,
that Bay store here in Winnipeg is closing early in the new year. That was the headlines recently. I think yesterday I saw that. So what has been, we have here at APTN covered, a lot of the struggles, a lot of the successes. Good Fish Lake in Alberta, they have a big, massive commercial laundry facility. They instantly said, let's just start making masks. So that was, a success story out of, kind of crappy situation of COVID. There's a Mi'kmaq business that they have 3D printers that go in classrooms for training purposes. Pulled all of those out and started making those big protective face shields. Can you tell us what are some of the other, big success stories that you're hearing that would kind of, shine some light on a otherwise pretty gloomy situation?
Well, again, a lot of those things that you're referring to, Melissa, did start as a result. I mean, I think the federal government right in mid-March was asking businesses to pivot. So again, we had a number of Indigenous businesses that pivoted to start supplying PPE. There has been some successes. There has been challenges. I mean, if you look at the federal government, they did have a set aside for Indigenous businesses for non-medical face masks. I mean, 7 Indigenous businesses did secure contracts for that for I think 15 or 20 million face masks. I mean, that's a success. 2 of those 7 businesses were Ccab companies, Animal Marketing and Integral Containment Systems. But there are other companies that have pivoted and they're supplying a lot to the corporations. So, I mean, when we look at procurement and we look at success, we have to rely on the federal government. The federal government, in my opinion, hasn't done enough. I know that it's a struggle for them with Indigenous businesses, and they are promoting utilizing Indigenous businesses. But we recently held an event, and it was a little bit sad to hear that some of the businesses no longer want to even pursue that avenue. But I think it does have to happen. What we do need to do is we need to celebrate our successes. And I mean, COVID is a bump in the road, but as Indigenous peoples and businesses, we've always had struggles. We've overcome them, and I think this is going to continue on. COVID is here in the future, is here in the present, but within the future it is going to go off, and we just need to continue where we've been going and making the successes that we have been having.
I love it. Well, and you know, through these struggles, there's everybody's struggling. There's going to be lots of opportunity, hopefully, for people to develop new relationships, new partnerships to get out of this. Philip Ducharme, thank you so much for joining us from the Canadian Council of Aboriginal Business.
Thank you very much, and it was a pleasure.
As Philip Ducharme had said when I spoke with him earlier today, the struggle is real, but it is the Indigenous way to persevere and develop new partnerships. He had mentioned a struggling Indigenous soap maker who was on APTN National News. Well, she's part of a group who are hoping to begin a new relationship with major Canadian retailers. Here's Sarah Connors with that story.
This will be okay, but obviously sales are so much less, especially without the tourism.
It's been a tough year for Nacho-Nyakdun soap maker Joella Hogan. With few tourists in the Yukon this summer and no cruise ships, business has been bust.
It was really, I guess, a punch in the gut because I realized how much my business really depends on tourism and the cruise line industry, because so many of the shops that carry my stuff are also supported by that industry.
Along with 20 other Indigenous women entrepreneurs, Hogan is now calling on major retailers to pledge 15% of their shelf space to Indigenous-owned businesses and help those struggling from the pandemic get back on their feet.
We're not necessarily represented, certainly not in retail space, but also in many industries. And so how do we encourage and support retailers to make that shift and support small businesses, because realizing the impact is so much larger when you invest and support Indigenous business.
Inspired by a similar pledge in the U.S. after the death of George Floyd, entrepreneurs like Hogan say it's time for Indigenous businesses to reap the profits, which usually isn't the case.
People are selling items with Indigenous graphics or images on them which aren't appropriate or Indigenous made, and so you're not supporting Indigenous people and communities when you're retailing those products.
Indigenous-owned brands are almost non-existent in the major Canadian retail space. Hudson's Bay Company, for instance, which carries about 1,800 brands, only carries one Indigenous-owned brand. And other major retailers like Simon's, Holt Renfrew, and Shoppers Drug Mart don't carry any. And while local shops like this one have been supportive, most major retailers have not responded to the pledge.
Some of them have made statements on them, some of them haven't, some of them are mute, which is pretty disappointing because there's so many opportunities.
Despite the lack of response, Hogan says it's the message, not the money, that makes the pledge worth it for retailers.
There are so many beautiful things that are coming from Indigenous communities, and how can we as Canadians support that so that all people can thrive?
Most companies I reached out to about the pledge did not get back to me. However, Hudson's Bay Company did tell me a diversity and inclusion task force is now in the works. Sarah Connors, APTN National News, Whitehorse.
We are all out of time. Thanks for being with us for our season premiere. Just to circle back to what we discussed earlier, staying mentally well during the winter season amid this pandemic. Later this week on APTN National News, we're going to get some tips from a trauma expert who is teaching people how to cope, so watch for that on APTN National News. As for us here, we've got lots of great topics that we will be putting in focus for you this season. Next week, Res Dogs, what communities are doing to care for their animal populations, rescue organizations that are lending a hand, and also the bad rescues. We've heard all about them showing up to sometimes take people's pets, to feed a growing appetite for non-Indigenous urban people who want the cachet of owning a res rescue and some sort of, I don't know, bizarre attempt at reconciliation. We're going to delve into all of that. So also this season, we are going to keep the spotlight on child welfare. Don't you worry about that. The Millennium Scoop is not forgotten here. Lastly, you should know that you don't have to sit in front of your TV or on Facebook Live to take in InFocus. You can listen to us as a podcast as you go about your day. We have dozens of episodes from previous seasons. You can browse through that whole library at aptnnews.ca/podcast. This and every InFocus is on there. I'm Melissa Ridgen. Have a great afternoon. See you back here next week. And I'm going to leave you with some amazing jigging vids from an online jig contest that was held this summer by our friend Ryan Richard.